This is the Health Matters program produced by the Ministry of Health. I'm Alicia Martin, your host for today. I'm joined by Dr. Travis Freeman, the head of the Drug Demand Reduction Unit of the Ministry of Health. Today we're talking about drug abuse and illicit trafficking prevention. Welcome to the program, Dr. Freeman.
Thank you, Alicia.
So, we are about to observe International Day Against Drug Abuse and Illicit Trafficking. Tell us, what is this day about?
So, firstly, I must tell you of the theme for International Day Against Drug Abuse and Illicit Trafficking. This year's theme is "The Evidence is Clear, Invest in Prevention." So, the Ministry of Health Drug Demand Reduction Unit, every year we join the United Nations Office on Drugs and Crime on observing the International Day Against Drug Trafficking and illicit use. So this day really is about raising awareness to the impact of drugs in society. However, although the drug situation is a multifaceted one that has to do with crime and the impact of crime on communities, our focus is the social and the health impact of substance misuse.
Definitely, and I know that you guys have been doing a whole lot of work over there at the Drug Demand Unit. Could you tell us a little bit about your unit and how you guys function on a day-to-day basis?
Certainly. So the Drug Demand Reduction Unit, we like to sort of approach the drug situation from three angles. We look at prevention, we look at treatment, and we look at recovery. As it relates to prevention, we do a lot of drug awareness, a lot of community outreach, and we have specific target populations that we address. You would appreciate that in every phase of life, there's some challenges.
Yes.
And with these challenges, persons look for coping mechanisms, and oftentimes it is a drug, it's a substance that persons misuse. So for our awareness campaigns, like I said before, we target different populations, primarily in and out of school youths, the young professionals, and also we're targeting mature adults as well.
Definitely. I'm glad that you mentioned the adolescents and the young people because we do see a lot of young people getting involved in drugs of recent and over many years. And so definitely we want to curb that. What new strategies has the Ministry of Health implemented to help eradicate substance misuse and somewhat help persons who are struggling in that area?
Okay, that's a wonderful question. And if we're going to go back to target populations, for example, in school youths, we have a robust prevention program where we do a lot of sensitization, but not only sensitization with giving information, we've also linked sensitization, drug education, and also physical activity. So even recently, we have had this wonderful project what we call Kick Drugs Out of School.
Interesting.
Yes, where we included drug prevention education and football, and in some cases, volleyball.
Very interesting, I must say. Definitely, young people would be interested in, being a part of that because it has this entertainment, edutainment kind of aspect of it.
Yes.
So I'm really glad that you guys are doing that. What has been the response like from persons a part of that program?
The response has been overwhelming and very positive. A lot of youths, gravitate towards the program. And what we would have seen, we've already started to see some of those positive outcomes. Because now we're seeing more youths are selecting to do more positive behavioral practices, more healthy choices. And we've noticed a decrease in interpersonal violence, particularly in those schools where we had this program introduced. We know that substance use has social impact. So we've started to see that there's a decrease in violence, and also there's a decrease in teenage pregnancy. Like I said, it's pretty early, but these are some of the trends that we're noticing.
And that's really tremendous. I'm happy to hear of those. I know in order for us to get the work done, a collaborative effort is needed. So could you tell us what are some or who are some of the organizations that you guys collaborate with?
Ah, wonderful. So, the Ministry of Education has played an important role. They're a crucial partner, particularly when we are addressing in school youths. But also, we have our non governmental partners that we must salute on this day, the Salvation Army, the Phoenix Recovery Project. Those are some key agencies that we work along with. And also, I must not forget the Drug Treatment Court.
Wow, tremendous. For those organizations who are out there and still wondering, oh, how can we collaborate? How can they get on to you? How can they do that?
Certainly, they can visit us here at Quamina Street, the mental health unit. As for the drug demand reduction unit, we're there. Also, they can reach out to us via telephone and email. So they just send an email or make a phone call, and we're here to collaborate.
Thank you, Dr. Freeman.
I got cigarette tower. Yeah. Like a pack now. But it was all these things for this packet.
Hi, mister. That is the new law. Them cigarette manufacturers have to put those images on them pack.
Yeah, but was all these scornful thing they got here by?
Because they're showcasing the effects of cigarette. And it also says
Smoking is dangerous to your health. Feel like I change my mind.
Let's all work together to prevent cigarette smoking related illnesses. A message from the Ministry of Health with support from PAHO WHO.
So, Dr. Freeman, when we hear the term substance misuse, what does this mean?
Okay, so in its simplest definition, substance misuse is when an individual uses a substance beyond for what it was meant for. And this can vary from what we know as illicit drugs to legal drugs. So it varies.
Okay, and what are some of these types of illicit drugs? And could you also highlight some of the legal ones as well?
Great. So oftentimes when people speak of substance misuse, we often think of the marijuana, the cocaine, the
Yes.
heroin, and they are being used in society, and it is a problem. But also we have to take into consideration some of even the over-the-counter drugs. There are certain pain medication and other medication that were prescribed for other things that persons are using outside of what it was prescribed for. And I also must mention alcohol and tobacco. They are substances that are being misused. Actually, alcohol, tobacco, and marijuana continues to be amongst the substances that are most misused in Guyana today.
Wow.
So, in addition, Alicia, there's some medication that are prescribed by the physician, but persons tend to misuse. If I may, let me just refer to one specifically. For example, there is some diuretics that we use. Diuretics are usually used to control person's blood pressure. What diuretics are used for, it allows us to get rid of sodium and liquid. However, we have athletes who are now using these diuretics to look more shred. But obviously, those have using
Effects.
diuretics, they have their consequences too. So, apart from getting rid of fluid and sodium, what some diuretics do, they also get rid of potassium.
Wow.
And potassium is responsible for muscle contraction. So you see those persons that they start to experience weakness, and they may even have heart rhythms, abnormal heart rhythms that can lead to cardiac arrest or a heart attack as we know it.
Could we talk a little bit about for those persons who are, using substances and maybe be misusing some of them, how can they get help? What can be done in those situations?
Great. If I'm to look at agencies first, any agency can do a referral to our department here at the Drug Demand Reduction Unit. Apart from that, we've been getting a lot of referrals from hospitals, the accident and emergency. We've been getting a lot of referrals from the schools and from, but what we've noticed recently, we've been getting a lot of referrals from individuals in the streets, which is a very good sign. It means that persons are accessing the services, they're getting help, and they're now making recommendations. So that is a significant success for her, for
Yes.
us, and we continue to provide and making these services available and accessible.
Definitely. What can parents or guardians do to help a loved one who might be struggling with this kind of situation?
Great, that's a wonderful question. So a parent or guardian can always bring that individual here to the drug demand reduction unit on Quamina Street, or they can contact us via telephone numbers. Um, our telephone numbers are 223-1406, or 223-6626. You can call us, you can make an appointment, or you can walk in, and we do walk in services too. Alicia, we've gone so far as to, we try to accommodate everyone. So what we do, we even go beyond the regular 8 to 4:30 hours. We set an appointment
Wow.
that is suitable for individuals.
Especially persons who working.
Exactly. And if a parent might want to attend this
Yes.
session, they don't need to take time out from work, or the child doesn't need to come out of school. They can come before 8 or after 4:30. The service provider is going to facilitate such.
Wonderful. What can persons expect when they visit the center here? What can they expect? I know some persons are still a little bit hesitant about reaching out for that help that they need. But tell us, what can they expect when they come?
So I'm glad you asked that too. There's no need to be hesitant. We have a comprehensive, holistic approach to substance misuse treatment. Um, and the treatment or the management of those persons would vary, and it's based on an individual, because no two individuals are the same.
True.
So in some cases, you would have the treatment officer, you might have a psychologist, a social worker, a mental health counselor, and that might be the team who is
Yes.
addressing a particular individual. And whereas there are other cases where you might just have a counselor there because that is the need of that person. But that is just to say that we have an array of professionals that we're willing to have involved in the management of persons. We've been managing persons, we've been managing adolescents, young professionals. Our service here is very confidential and private, so there's no need. We have high profile clients that no one knows of and who've been progressing very well. We had person that we've gotten off of the streets, and now we have reintegrated them back into their families, back into their
Wow.
communities. They're working, they're contributing to society, and that is what we're all about.
Definitely. For persons who are at home and maybe struggling or knows of someone struggling, what are some good coping mechanisms that they can adopt?
Great. So there are always positive, healthy coping mechanisms. Um, and some of that include a lot of physical activity. Some people would go for a walk in the park. Some people would pick up a reading, listening to music, talking to someone, reaching out to a healthcare provider. So anytime you notice an individual, they might be distant or they may not be themselves, you can always reach out to us at the Drug Demand Reduction Unit. Um, like I said, we facilitate everyone. We have some screening processes So it's everything we do is evidence based, is evidence informed, and is of international standards. We've collaborated with agencies like the OAS, like the UN, and those are who our professionals were trained by. So they're internationally certified, and we are looking forward to provide services using the best practices.
Yes.
We understand our society is evolving and is evolving rapidly, and we must evolve.
Definitely.
And our services must evolve and accommodate the needs of everyone.
Thank you, Dr. Freeman.
Quitting smoking can save your life and can help you live up to 10 years longer. Quitting also lowers your risk of many diseases, including cancers, heart disease, and pregnancy challenges. Benefits of quitting can be seen in just minutes to days. Your heart rate will drop, allowing your heart to not have to work so hard. Carbon monoxide levels, poisonous gas in your blood, will normalize. You will cough less and breathe easier. Even people who have smoked for many years benefit from quitting. It's the best way to protect your friends and family from the health risks associated with secondhand smoke. For further information, contact the Chronic Disease Unit 223-7355.
Dr. Freeman, I see you guys have this lovely corner set up, very friendly. When persons come to this side of the room, could you tell us what happens here?
So great. This is one of our and like I said, our clients vary with age, gender, and so on. So, for example, if we were to take this item here, this may seem like a simple puzzle.
Yes.
But one of the activities that we do is that we would put this one piece on the puzzle board, and we encourage the clients to take another piece. And with each piece, you try to put together the puzzle. However, each piece is random and may not fit every time you choose one. It may not relate to the piece that was said there before. So we encourage that person to put it aside. What this does is to tell you that, listen, every day you have a little slice of life, and it may not fit in immediately, but what we can do, we can put it aside and then come back to it later, having gone for another piece, and then eventually at the end, all of
all
it
will come
together. And exactly, and that is how substance use is. A lot of people think that treating and getting over substance use is an overnight activity.
It happens over time.
But it happens over time, and it's progressive. And that is what we do. We provide that support for individuals. You don't come here and expect to be cured the following day. But what we do, we provide that social support. We provide that guidance to get people back on track. And in substance use treatment, we speak of the road to recovery. So we're continuously there getting people on the road to recovery, even when we incorporate them back into their families and back into their society. We still provide social support, psychosocial support for those persons.
Which is definitely important. And I know after persons would have been through this process, they're able then to encourage others to come down here as well and be able to benefit from the wonderful services that you guys offer. I am able to see a few drawings on the wall. I am sure that it was done by persons that would have came through the program here. Could you tell us about this one right over there?
Wonderful observation, Alicia. So this was done by a student in Region 9. We had an outreach there, and we asked them to, what was their depiction after we finished doing our awareness session with them. And on this graph, the child depicted, she said, say no to drugs. And her reasons for saying no to drugs is that eventually, with social issues, you'll get poor hygiene, you can develop lung cancer.
Wow.
She referred to depression, hallucination, trouble with the law, death, and at the bottom, her last message was seek help for substance misuse. So this just goes to show how impactful our awareness and sensitization sessions have been, that we are making an impact on youths. And the idea behind this is to delay the onset of substance use. We believe that if we delay the onset of substance use, seldom you would find an adult age 20, 25 who starts to use a substance, right? So if we delay that onset, we believe we'll delay the incidence or prevalence of persons using a substance.
Definitely. Dr. Freeman, tell us about your drug treatment program.
So, like I mentioned, one of our key partners in drug treatment is the drug treatment court. So, if I may talk a little on the drug treatment court, so from the drug treatment court, we have a lot of referrals, and we are a part of the team
Yeah.
who deal with clients or participants of the drug treatment court. The drug treatment courts involve persons who've committed non-violent crimes and whose crimes have been linked to substance misuse. So once that individual pleads guilty, they're then introduced into the program, and this is where we give a lot of support. We do an assessment of the individual, and after that assessment, we develop a management plan. And the team includes a caseworker, a social worker, sometimes a physician, sometimes the psychiatrist or mental health, dependent on the needs of that individual. So there's a continuous monitoring and
Yeah.
evaluation of the individual, and then we also try to incorporate skills training, and this goes for all the persons who enter into our treatment program. We try to include some skills training. Once that is complete, we try to get them into a job and so on. But like I've mentioned, we've had persons who we've taken off of the streets and who are now in society, in working, who are now contributing to the home, contributing to their
Yes.
community and society.
Indeed, the program is working,
Yes.
and that we're most happy about. For those persons who are watching and listening to the program, what would be your encouragement to them if they know of someone, someone that they know is struggling in these areas that we would have mentioned, or even somebody that is on the streets? There's still hope for that person. What would be your encouragement to them?
Yes, definitely there's hope for that person. Like I said, our program is available. You can come and call us. Also, we've expanded our programs to other regions. So you can access drug treatment or counseling in regions 2, regions 3, regions 5, 6, 7, 9. So, and we're continue to expand. So at the end of this year, we're going to even expand further, and we're expected to have a presence in every region. And this is enormous because what that does is that it ensures the availability and accessibility of drug counseling and drug treatment services at the community level. So no longer you need to come to Georgetown for specialized services. Now you'll be able to access these
Right
services
in your regions.
very well, right in your community. So right at the community, the primary healthcare centers, you'll be able to access drug counseling.
That's awesome news. I want to say great job to you and your team down here at the Drug Demand Reduction Department. I want to encourage you guys to keep up the good work that you've been doing.
Thank you, Alicia. We really appreciate it.